Hi, do you get pain here around the elbow? Do you get pain around this area? Do you get pain while lifting something with your hand, or lifting a water bottle, lifting a coffee mug, or holding something heavy in your hand? Then you could be having tennis elbow around this area. Okay, today in this video what we are going to discuss is how we can manage the tennis elbow at home. Now, tennis elbow is a very common condition. It terms tennis elbow, but it's not just common with the people who plays tennis. It's very common with people who plays or do a bit repetitive activity with their wrist or with their elbow, or who carry a lot of weight in their hand. All these could be contributing factor for the pain. Sometimes due to diabetes and other reason as well, this tennis elbow can sort of affect you. If you need further information about why this tennis elbow happens, let me know in the comments so I can make another video of it. We need to start giving that relaxation massage. For that, come down to the bony area over here. Now we don't have to massage on the bone. We need to come down slightly and you get this fleshy bit around this area. And we need to place our two fingers on that area like this. So your muscle is going like this and you're placing it perpendicular to the muscle. Place it and then give a gentle massage like this. Okay, so I'm not going very deep. I'm not digging in. It's not causing me ouch kind of a pain. It's more like a gentle friction massage. So the muscle is going this way. I'm just giving it a bit of friction by doing this movement. Okay, I'm not digging in very hard. Okay, massage doesn't mean it should be painful. So digging in, giving a gentle massage, counting 10 to 15 and then relax. See how you feel. If you feel painful, don't repeat it. If you don't feel painful, then do it more 2 to 3 times. Okay, you can apply ice around that area, or you can take an ice cube and do the friction massage with the ice cube as well, depending on your comfort level. What ice does is ice just numbs that area and it travels faster to the brain. So that's why the pain feels a bit lesser compared to the cold sensation. That's why ice works. Now, after that, we need to stretch that area. We need to give it a bit of mobility. We need to give it a bit of stretch so that it will start acting or start getting a bit more length. Okay. Now, usually people offer passive stretching. It's good, but your tendon is more active component. So you need to make sure we are giving them the active stretching rather than the passive thing. Active stretching has been proven to be beneficial more than the passive stretching as per the evidence. So how we can do that? We need to start, bend your wrist like this, apply slightest amount of force with your other hand. Now what we will do is extend your elbow and come back, extend your elbow and come back, extend your elbow and come back. I am not losing the contact of the wrist and the other hand. I'm keeping that intact throughout the movement. What I'm moving is just my elbow and relax. I'm not lifting my shoulder up. I'm not moving my neck. I'm very relaxed while doing this movement. It's just get the stretch, come back, get the stretch, come back. Do that for 10 repetitions. If you feel pain after doing 5 repetitions, 7 repetitions, stop there and then try it again after some time. If still painful, then maybe reduce the resistance that you're applying here, or maybe just go halfway and come back. It should be comfortable to do this movement, not painful. Number 3 is to strengthen that area. Tendon loves loading. They love just right loading. So you need to make sure that we are loading the tendon appropriately. If you underload it, if you don't do anything to that tendon, your tennis elbow pain will not go anywhere. Okay, I've seen multiple such patients who said, I've been suffering through this pain for around 7 months, 8 months. It's just not going because they have not done any loading to that tendon. They are just trying to avoid the movement. They are just trying to rest it. Rest is not best. You need to make sure you move it. Okay, so for that we need to get a water bottle. If you see, I have filled it up to this mark. You can fill it as per your comfort level. What I usually suggest my patient is fill the water bottle halfway up, try and attempt to do the movement. If you can do 10 repetition, then that level is for you. If you can't do 10 repetition and if you start feeling a bit of pain after doing 5 or 7 repetition, then maybe reduce the level of water and then reduce the level of water and then see whether you can still do 10 repetition. If it's still painful, start with a minimal amount of water level or maybe no water in the bottle, and then start doing that movement and get comfortable and slowly add the water in the bottle. Okay, this is the exact same technique I show my patient, because usually some patients don't have dumbbell. It's very accessible to have a water bottle, and it's visually easy for us to see how much load we are taking with the amount of water we are taking extra in the water bottle. Okay, that's why it's excellent. So this water bottle, what we will do is we will keep our elbow like this. So my shoulder, elbow are almost in line. My wrist is a bit outside of the table, so I can do this movement easily. Okay, I'll take a water bottle and I will make it horizontal. I'm not going to hold it vertical firstly. I'm going to make it horizontal. And what I'll do is I will lower my wrist down. So I will do full flexion and then I will come for full extension. Okay. So I'm not sort of doing this. I'm going to do a very slow movement of going down and then coming up, going down and coming up, going down and coming up. If you could see, my elbow is not moving, my shoulder is not moving. I am just moving my hand. Okay, so 1, 2, 3, 4, 5. Likewise 10 repetition depending on your comfort level. To make it a bit more challenging, after a few weeks you can start adding hold. So you're here, you will come midway, 1, 2, 3, 4, 5, come upward, 1, 2, 3, 4, 5, go to the middle, 1, 2, 3, 4, 5, go down, 1, 2, 3, 4, 5. Can you see I'm not relaxing my elbow completely? I'm keeping the tension throughout the movement and I'm holding at the 3 position. So over here at the mid range and at the down. Again 5-second hold, 10 repetition depending on your comfort level. After adding hold, you might not be able to do the same repetition. You might be able to do less. It's fine. You can always improve it. As long as you're going progressively up, that's absolutely fine. Now the 4th exercise we need to do with the same water bottle is placing the water bottle vertically. Your elbow, shoulder and your forearm is resting on the table. Now we will start lowering the water bottle and then coming back. Lower, coming back. Again 10 repetition. Now you can start adding hold the same way what we did for the earlier one. You will go down, hold 1, 2, 3, 4, 5. You will come midway, 1, 2, 3, 4, 5. You will come up and 1, 2, 3, 4, 5. Okay. Now usually we also get a bit of tricep weakness or tricep related pain along with the tennis elbow. So for that, easiest way to manage that is you need to again use the same water bottle. My elbow is exactly near my head like this, straight with my body, and what I'll do is I'll extend it and I'll come back. I'll extend it and I'll come back. Okay, so 1, 2. Can you see how slowly I'm doing the movement? I'm not rushing to do 10 repetition like this. I am doing it very slow. 1, 2, 3, 4, 5. This is the exact same way you will do the tricep extension for the muscles over here. If you are unable to do it, or even with the smallest amount of water, your hand is going this way or you are going this way to do the extension, then we will not do that. We will do the alternate method. For that, you will keep your shoulder like this, 90 degree. Okay, so your shoulder is in line with your chest, and then what we will do is we will extend the elbow. Okay, now if you have any shoulder difficulty, this way it would be a bit painful, so try and attempt to do that with the no weight. But if you still want to try with weight, you can try and do it this way. If you need support over here, you can take that, that's absolutely fine. And then we will do this movement. Okay, so we are extending it. Okay, so extend, relax, extend, relax, extend, relax. Again, 10 repetition, 3 sets. All the exercises I'm saying 10 repetition, 3 sets. For you, it might be a bit difficult to do them. You can start with 5 repetition, 7 repetition. Make sure you're increasing it up to 10, 20, up to 25, depending on your comfort level. Throughout the exercise course, you shouldn't feel a lot of pain. The pain should be like a discomfort. It should not be like a very, very acute pain, or a pain which would cause a bit of inflammation or swelling around that area. If that kind of pain is appearing after exercising, then you need to ask yourself, am I doing it appropriately? Am I taking too much load? What am I really doing? And based on that, you need to figure it out. These were the self exercises for the tennis elbow. If you're still having the pain around the same area after trying the exercises, or if you're confused, is it still a tennis elbow or is it something else, make sure you see your physiotherapist. If you want to see me, you can comment below or DM me over Instagram, so I can book a one-to-one session along with you. I can send you a booking link and we can see each other. If you have any other question, or if you have any other pain related question, post that into comment so that I can start making videos on that. My goal is to make sure it reach more people so that I can help more people. If you like this video, please make sure you subscribe to my channel and like this video. Share it with the one who are suffering with elbow pain, or the one who have been going through a lot of pain around this area or tennis elbow, so that they get some help due to this exercise. Till that time, thank you so much for watching and happy recovery. I'll see you in my next video. Bye.